Okay, awesome. I was going to do a live stream on YouTube, but apparently, oh, and my lighting is awful again. Let me see if I can fix that real fast. Okay, that might help a little bit. All right, cool. I should probably even move this to face the lights a little bit more. I was going to do a live streaming on YouTube, but turns out I don't have 50 subscribers. And you have to wait 90 days from after you've created your account before you can do that. So no live streaming for me today. So I was going to go ahead and get bothered with all the other tasks on my list of things to do, but then I realized, you know what? I'm trying to stay dedicated and get this channel going so that I can have a catalog of information that I want to share and keep for myself, but also so others can learn from it as well. So I wanted to go ahead. I was going through my day today. I was working. I have a job that's remote, and I had to make some phone calls to get some medications. Some of the medications I'm taking. Okay, so before I get into it, this episode is going to be talking a little bit, just a little bit, on health insurance. And the reason being, I have a new health insurance provider because I just started a new job about 5 months ago. And so I signed up with them. And the healthcare is awful. So if you use Oscar, Signia, or Accredo, which is online medication delivery, don't just go to open enrollment and pick a different plan because they're a nightmare to work with. Totally not worth it. Their deductible is awful the way it is. And so save yourself time. And if you have any option from any employer to get Oscar, Signia, or Accredo, just don't. Aside from that, I love my job. I love my office. I love the people I work with. We are transferring to a new healthcare. I don't think I was the only one having trouble with them. So in a month, we will be signing on with a more universally well-named healthcare. Doesn't make healthcare any better in this system. Just the fact that that new provider I will be getting will be more recognized. So getting medications when I need to shouldn't be an issue. And I hope this is recording. So that is what I'm going to be talking about today is health insurance. I have 4 points I've made. I don't know that we'll cover all of them because it's a lot. And I haven't gotten all fancy with my editing, and I haven't, I don't even think I want to do that. I kind of want to hire someone to just do it, but I haven't figured that out yet either. So if I could, I would put a list up here saying we're going to talk about A, B, C, and D, but I'm not going to because I'm not going to get that fancy. And so basically what I want to talk about today is working a conventional job, whatever it is, if you work with, wherever you work, traditional work-related, employment-related medical insurance. So I want to talk about that. I want to talk about how you leave the workplace to either just take a break from working for a few months if you're sick of it, or to get a new job or to go back to school or whatever it is. So just going to talk about how you make that transfer happen and who you talk to in your company. Going to talk about what insurance you may have. You may have a primary, you may have Medicare, you may have a work-related insurance, so you may have multiple. You may just have one, but I'm going to talk about that. I'm also going to talk about copay cards. I do have a couple copay cards, and they don't work. And I'm going to talk about why they don't work, because I want to inform you. And then if you have information that you can share with me about cards that actually do work, please send me an email, leave a comment, do whatever you want, because paying for medications, even with a deductible, because healthcare organizations are just so fabulously good at the fine print details that lets everybody know that they're not actually going to cover anything. And in the end, is it even worth getting health insurance? No. Some people would say no. Some people don't pay for it. With the unfortunate fact that some of us do live with chronic conditions, which in and of itself, the wording may make it seem worse than it actually is. I would not go a day without it. Unfortunately, I'd like to drop the F-bomb in there a few times, but so we're going to talk about copay cards. Here's an example of one. feel free to take my group number, bin, lot number, issuer ID. I don't really care because I can't use it. And then the last one, I really doubt that I'm going to have time for this, is to talk about a new federally released healthcare coverage for individuals who are on transplant medications. So lots of stuff. So I'm just going to go ahead and start going through it. Actually, I'm going to do that last one first because that's a fun one. So if you, I'm not sure if this is a Midwest thing, this is an Iowa thing, or this is a whole country thing. I'm not really sure. I personally have lived on the West Coast and lived in the Midwest. I currently live in the Midwest in Iowa. And so I don't know if this is like a regional thing or a whole federal thing. But there is a program that was released in very end of 2023. It is now open for individuals to enroll as of our open enrollment timeframe, which is coming to an end quickly. I believe it is open from November 1st until like December 15th or something. And during that time, if you're an individual who has ended their 3-year, 36-month time frame of no dialysis and a successful kidney, that is when you no longer qualify for Medicare. It's screwed up. Everything in healthcare is screwed up. I can't stress that enough. Even if I am sharing the things that are working, none of it is actually working. But these are the little navigated paths that you can take to attempt to make your life a little bit easier. And please, again, share with me anything that I don't know that would make my life easier. So the new law that you can sign up for essentially says that when you have surpassed the 36 months and you are no longer qualified because you are successfully living with a transplanted kidney, you do not qualify for Medicare. You will get a letter in the mail and it will say, I actually have the letter. I saved it. I was going to frame it. It's on my thing over here because I was like, that's like a once in a lifetime thing that I'm going to get. I have personally had Medicare since I was 6 years old. So I have had Medicare for most of my life. And I don't have it anymore. I stopped getting it like 3 months ago because I've been successfully living with a transplanted kidney. So I got the letter. And ultimately that means you cannot give your insurance, your Medicare insurance card to anything for any medications, for any procedures, because it's not going to cover anything. So you either have to, at that point, go to the open marketplace and get a plan. And if you are living with a chronic health condition, such as kidney transplant of any sort, you will only qualify for a PPO plan. You will not qualify. Is that right? PPO? No, you will only qualify for an HMO plan. There are PPO plans and there are HMO plans. I have a few different healthcare providers in my phone to call them if I have any questions. I would share their numbers up here because they're incredible and amazing ladies that have helped me so much. But I don't have that. And again, I don't have any fancy software to add it up to the screen, so I'm not going to do that. But I should, so maybe I will at some point in time. Essentially, you sign up for that. And so what this allows you after that 36-month time frame is, well, sorry, I was talking about the open enrollment. So yes, if you live with a chronic condition and you look at the fine print, nobody is going to qualify you for a PPO plan. You only get a PPO plan if you are listed with your employer, because employers have this umbrella where they allow every single person in their employment, aside from underlying circumstances, to qualify. So that is the only way you can get a PPO plan. The nice thing about a PPO is you can be seen basically in any state in the country, which is fabulous because you can live anywhere, like in Seattle or Iowa or wherever you want, and be seen by providers in multiple states. And it makes your life easier the way it should be for everyone. But if you don't qualify and you go to the open marketplace and you're not getting it through work, most work will have PPO. I don't know of one that doesn't. Mine have never. If you go to the open marketplace and get a insurance plan for yourself, you as an individual living with any kind of kidney related thing will only qualify for an HMO. The downside with HMO, I wish I could put up PPO and HMO and tell you the differences. PPO, I already told you, the biggest thing is you can be seen by anyone. HMO is that you will only be seen by individuals in your state. In your state. So I guess that's not a big deal for a lot of people, but for me, I don't like that. Because if I want to go live somewhere else for a while, like, I mean, I guess it's fine if things aren't of concern or you don't have issues. And if you do have issues, you're probably not flying around everywhere anyways. But the idea being, if you live with any kind of chronic thing, our government won't allow you to have a PPO plan. You will only ever get to be confined to the state you live in, and you will only ever get to have an HMO plan. Period. That's it. If you happen to make, if you happen to not be employed and meet the criteria, again, if any of this, you have more questions, leave comments below. I'd also highly encourage you to just look up a YouTube video. That's what I do for everything. And then I call the right people and verify it or ask them questions that I have. Now, I have totally gone on multiple different tangents. That's why I don't think I'm going to get through my list, which I wish I had up here on the side. But let's get back on track. I wasn't even going to cover anything about what I just talked about, and I did. So I hope that helped. Now, getting back on track with the new transplant law that was federally passed and is now open for qualifying candidates, you can sign up. And because I'm regionally in Iowa, again, I don't know if this is a federal and this is a countrywide thing, a Midwest thing, a West Coast thing, or what it is, but I call my governing body, that is the SHIP office, SHIIP, or else SHIPP. I think it's SHIIP, SHIP office, and that is essentially connected with Medicare dispensaries of sorts. And I call there, and then I make an appointment and say, hey, I would like to sign up to see if I qualify for the Medicare coverage plan that is now been federally passed, because right now is the enrollment. And then January 1st is the time at which, if I do meet the criteria of the enrollment, I can then get Medicare back. So essentially, I have Medicare the whole time I have any aspect of ESRD and stage renal disease. Everybody should have it. You even get it as having a transplant. When you are successfully living with a transplant for 3 years / 36 months, you don't get it anymore. So now you're shit out of luck and you got to figure out what to do. Until recently. So I don't know the name of this law, but basically the premise of it is that it was federally passed because essentially, the burden of having to pay for a tier 4 drug medication, which is what 2, 3, or even 4 medications are for anybody living with a transplant, most likely, you may even have more. Those are the most highly expensive medications and the ones that healthcare coverage companies will require you to pay a high deductible. Hence why I wanted to have this call, because I was talking to a Credo Healthcare Oscar Signia who has a crappy plan making me pay a lot out of pocket, and I don't like that. And so essentially, since I don't have Medicare to cover the cost of those medications, I also don't want to be set up with a crappy healthcare service, which I currently have. And so essentially, if you're in the exact position I am, you would call your Medicare office or Medicare provider or someone in Social Security in your state or region and ask them about this. And you probably just go to the Open Marketplace and they can direct you, or talk to somebody in your hospital, a social worker in your hospital. They can give you information. The social workers in my hospital are honestly like a godsend. They know all of the answers that I have no idea to and point me in the right direction. So essentially you call, and if you do qualify, qualifying candidates, I don't know all the criteria, but essentially what it is you had Medicare prior to your current application process. You had it during your transplant and before transplant. And I'm not sure of any other qualifications. I just know it's that. Another qualification might be that you don't currently have an insurance, which I hope it isn't, because I do and I need it. So I'm not sure because I haven't done that. I'm calling them tomorrow to figure it out. But if you do qualify, so number one, call your office, ask about this, enroll in it, and see if you qualify. If you do qualify, you get signed up for Medicare Part B, and that covers the mass majority of your transplant-related medications for the life that that organ is inside of you, and you are in need of taking those medications, which is a grossly massive financial support for individuals like myself. Otherwise, I will be paying close to $350 a month, if not more, on medications, even after my deductible, because tier 3 or tier 4, it goes, I don't know what it goes up to, it's like tier 1, 2, 3, 4. Because otherwise tier 4 medications do not stop getting paid by me once my deductible is met. That's the way the fine print works in our lovely healthcare system for individuals like myself who are otherwise screwed. And so before this, many social workers that I have talked to have multiple times explained to me why this can be challenging and stressful, because I've been experiencing that. And the reason why it is so good that our federal system finally decided to come out with a law, which I am so grateful happened now when I need it for the first time in my life, because it is absolutely not an uncommon thing that individuals who go through a grueling transplant process and live successfully for 3 years, 36 months after transplant, will then decide to just not take their meds, allow their kidney to fail, to go back on dialysis to get back on Medicare because they can't afford the cost of the medications. Seems like there's something we could do to fix that problem. And our law now has done that. So crossing my fingers, I meet all the qualifications, because it would be really nice and supportive to my life to not have to pay that 20% deductible that will be nonstop for my whole life. So wish me luck. All right. So that was like definitely a bit of a rant. Like, if you can't tell, I get emotional, I get like frustrated, and I need to like really work on that. I need to be a little bit more positive and like, yeah, but all right. So emotions coming out at play here for everybody. Now, we are not going to get through all this because I'm already ready to sign off of here. Copay cards, I'm going to go ahead and just cover this real fast. So copay cards like this thing here, basically your health insurance will, they should, if they're like helpful, tell you some places that they would recommend that you call for copay cards. They're called copay cards. They help pay your copay. Got that? You have a copay and they pay your copay. So it reduces that cost. It might not reduce it to zero, but it could reduce it to like one of these things says pay as little as $15. Yeah, but it doesn't cover my medication, even though it says mycophenolate Cellcept. And this says Prograft, tacrolimus Prograft. It doesn't cover it. And the reason why is because there's this little thing called an NDC code. Every medication has an NDC code. And essentially, every medication is, there's the chemical component of the medication, there's the pharmaceutical, and then there's the brand. And a lot of time, the chemical component of the medication is identical, but the brand is different. So different branded elements who want to take advantage of people like me, when I pay for shit and when I have a healthcare coverage, they will brand their own thing and they'll jack up the price compared to the generic. So essentially, a lot of times their branded element will do the same thing as anything else, but a doctor won't want to prescribe anything else because, I mean, they're making sure that your life is okay. And if your life is okay, I believe that there's some element of a fear factor of like, let's not rock the boat if things aren't sinking. And so they don't want to change it, even if the chemical consistency is the same. And so essentially, places like Genentech or McKesson will somehow distribute these copay cards to help people not like me, which would be super great, except for the fact that the NDC codes on the medications that they cover are not generic. They are some other branded element that has a very compatible chemical consistency to cover the needs that I unfortunately have to take these medications for, and as a result will not cover anything, even though it says Celsep mycophenolate. The only reason is because that Celsep mycophenolate isn't their branded NDC version of that chemical consistency of that medication. So just love going down into those rabbit holes when it comes to our healthcare system, don't you? So if anybody has a copay card that actually does work, I would really, really appreciate it. That would be so helpful so that I don't have to pay not just these co-pays, but my deductibles. Like, oh my gosh. Okay, so yeah, send me an email. Give me a call. Just like call me and tell me. I'd like to get on that. All right, so next thing real fast. So if you have multiple different healthcare insurances, I know when I was working at my old company, I had that insurance. I also had Medicare insurance. And when I was younger when working, I also was on my parents'. So I actually had theirs. So I had Medicare because I have it because of ESRD. And then I had work because work gives it to you. And I'm not going to say no to that if I can get like healthcare. And then my parents had it. Now, some people might like jump the gun and think this and be like, wow, Jenna, you're so stupid. Like, if you have three, don't you have 3 deductibles and 3 copays depending on like what you're doing? And yeah, actually that's the case, but it takes Jenna a little bit of time to figure this shit out. And so I wasn't really that smart. Instead, I was getting like super uncomfortable with the fact of like having one of them go and then another go and then another go, that it really was like a mental journey for me to figure that out and like calculate the math and be like, oh yeah, it's not smart to do that. So aside from that, the point I wanted to get at is that in this case, you have a primary, a secondary, and a tertiary insurance. And so that you can avoid the headache, what you may want to do is ultimately your primary is going to be your work. Your Medicare is always going to be the last one because that's going to be the last on the tier to soak up whatever is left that the other things are not soaking up. And essentially the reason why is because this will cover all the kidney related stuff that none of these things may not. So you always want to have your primary as your work related and your secondary or tertiary or whatever. Your Medicare is always last. And your hospital will always ask you which is your primary. And so just so you know, that's the case. I've done it backwards before, and then it took forever to get things filed and billed, and things were billed wrong because the healthcare system didn't actually know how to do it either. And so like I'm having to learn it and then teach them because they're billing it wrong, and then I get it. Some people are so dumb these days, my God. And you know, me included, except I'm the one that has to take the initiative to figure it out. So don't make the same mistake I did. There's a little note for you. Okay, last thing I'm going to talk about real fast is COBRA. So if you want to leave your work and you're paralyzed, you got paralysis because you're like, I can't leave work because I got this condition, and it's scary. It's scary. Things are scary. We don't do things because we're scared. We dream more than we act. That was kind of random. Yeah, anyways. So there's talk to your support because you can. Go to HR. Every company, if you have company healthcare, is required to share with you and tell you your rights with this thing called COBRA. COBRA ensures that you will continue to have healthcare from your company for as long as that year. Is that right? Yeah, I think it's for as long as the company has that, which is typically annual. It's January 1st to January 1st. It's a whole January 1st to December 31st. It's a whole year cycle. So if you want to leave your company or you get let go or whatever it is, there's certain circumstances. If they fire you, I don't know if you have access. You should still have access. I think if they fire you, you're not eligible for any kind of like payment assistance, but you still are allowed COBRA pay, the COBRA healthcare. So if you leave your work electively or non-electively, ask HR about COBRA and how COBRA works. So essentially you sign up for COBRA and you keep paying. Now the payment structure is a little interesting because depending how your company is set up, typically your monthly payment comes out of your paycheck when you're working. And it may be like $30 a month. It's really not that much. The biggest element of it is your deductible and all your copays. But if you leave the work, your work will no longer cover that element for you. You will still have the health care, but you will have to pay for it as though you picked it up from the marketplace. However, for me, this was the right choice when I had to leave when I left one of my offices. And it gave me time to talk with my social worker and talk with someone in open enrollment about my options to make sure I was fully covered. At the time, I had a transplant. It was kind of working, kind of not. And I still had Medicare too. So I did have one, and I was just working through the others. So essentially what you do is, let's say you want to leave, you want to get a new job, you want to take a break, whatever. Before you leave, figure out what you're doing. Don't just leave. Figure out what you're doing. Line up another job. Line it up even if you know you want to take a 3-month break. Just like have it lined up. Know what your next step is so you can launch off and you can be comfortable instead of stressed. Sign up for your copay. I mean, not your copay. Sign up for COBRA. Talk to someone in open enrollment, because anytime you leave an office, your open enrollment period is automatically open. Typically, the way it works is between November and December, everybody in America gets open enrollment. Maybe you need a social security card. I don't know. But essentially, it's open for everyone. You pick up a healthcare plan. Now, that window opens for you at any point you leave an office, from what I understand. Any point you leave a job, that little phase opens up for you so you can figure out a plan. So sign up for your office's COBRA pay. Even if you don't need it, I recommend signing up for it and having it for at least 2 months, and have there be at least a 1 to 2 month overlap between anything you decide to pick up if you want from the open enrollment and your COBRA pay, which is your current healthcare plan from your company. And then, because you can the way it works is basically you can continue paying the COBRA as long as you want until the end of the year when it ends for everyone in the company. So, in that time, go to the open marketplace, figure out another plan that would work for you, and sign up for that, and then stop paying and stop using that plan. Tell your HR you're stopping to so they're aware. Most people care about you. It's just a lot of times it doesn't feel that way when you have to pay a bill. It's just like a slap in the face, and then you forget humanity does exist. It just doesn't feel like it a lot of times. And so let your HR know. They're there to support you and make sure that you're okay. And so you've got the COBRA, you've got the open enrollment, you've got the Medicare I talked about, the 36-month plan. Talk to your SHIP office about the new law regulations for anybody who's living with an organ transplant in America. You now can have all of your medications covered on a Medicare Part B plan. Talk to your open enrollment Medicare office. Get the details, get enrolled, and get signed up, because I don't want you to have to pay exorbitant costs on medications the way I don't want to have to pay for it. And that's it. This was a way too long video. I probably surpassed the limit been allowed. This was probably a waste of time. But I hope that this gave you some insight and some information. And I hope you watched it on 2 times speed or 6 times speed, because I rant way too late. People walk away. They don't really walk away, but I would walk away if I were me and I kept ranting this long. So I don't disapprove of you wanting to buzz on through. I watch everything on 2 times speed. All right, that's it. Signing out. This is the insurance episode.